Coming to classification of burns, you have 4 degrees of burns. The first degree, second degree, third degree and fourth degree. The first degree is nothing but a superficial burns where only the skin and the epidermis are involved. It is quite red and painful because since the epidermis is involved, the nerve endings are exposed and definitely there is pain, but there is not blister in it. Then you come to a second degree burns, which is nothing but a partial degree burns where your skin, epidermis and a part of the or a half of your dermis is involved. As a result of which your nerve endings are still exposed, damaged, and there are blisters formed and it is extremely painful burns. Then when you come to the third degree or the full thickness burns, wherein the skin, the epidermis, the dermis as well as some layer of subcutaneous tissue is also involved, resulting in a white or blackened or charred skin. It's almost like your zone of coagulation you're reaching. So there is a charred tissue present and this is not painful. Always remember, there is no pain here because your nerve endings are completely destroyed. You have reached to a layer which is not having a nerve ending at all. A destroyed nerve ending, no pain is a full thickness burns. Then you have a fourth degree burns which involves much more deeper than your third degree burns, involving muscles and veins, and here also your nerve endings are totally destroyed and there is no pain. So both in third degree and fourth degree burns you do not have pain. You might have some amount of pain in third degree, but fourth degree burns is absolutely painless. Then indications for referral to burn center. So there are certain indications which is certified by American Society of Burns and which says that if your patient falls under this categories, you definitely have to refer to them to a burn center for an advanced level of management. So what is it? The first indication will be definitely second degree burns of more than 10% of total body surface area. The total body surface area, how to calculate it, we'll learn it in the next slide. Then you will have third degree burns, then burns that involve the hands, feet, genitalia, perineum and major joints. Without fail, always remember this, burns involving your important areas, that is your face, your genitalia, your hands and feet, your perineum and your major joints. Then obviously your chemical burns, inhalational burns, electrical burns, including lightning burns, because your inhalational burns always have a high incidence of ARDS which can be involved, your lung injury can happen, and electrical burns are more or less always associated with arrhythmogenic potential. So it is better to refer them to a higher referral centers or a burn center. Then any burn with concomitant trauma in which burn injuries pose risks to the patient. So you'll be wondering like why there should be a concomitant trauma in a burn. So what happens is whenever there is a burn or whenever a patient is burning, the flames, the pain and the movement which the patient occurs from here to there, or he starts running and starts, or if he falls down from a building or in a event to rescue himself, the burns is more or less always associated with fractures to the other major joints. That is why we call burns as a polytrauma. So any burn which is also associated with other trauma involving the other organs or other bones and joints, better refer them to a higher burn center. Then patient with pre-existing medical disorders or comorbidities in which you think can hinge your recovery or hinge your management and can increase the mortality, refer them. Then if your hospital is not equipped with qualified personnel or surgeons or equipments to take care of burns patients, especially pediatrics, it is better you refer them to a